So in terms of doing good lipo, it starts with the pre-lipo consultation and understanding enough about the patient's weight and making sure that lipo's not being done on an unrealistically low weight. That would be a really bad move. Then it's about being very meticulous. So I do my lipo very carefully. That means first of all, I'm doing everything. And don't expect that that's a given everywhere, because it isn't. Okay, I know plenty of surgeons that do the sucking and don't do the infiltrating, and that blows my mind. You need to do everything. And infiltration is when we put that fluid in. That has to be done well and evenly, because if you put fluid in unevenly, you make the body look uneven, and then you're correcting something that wasn't there really. So I do meticulously. You have to wait 13 to 15 minutes between injecting the fluid and sucking out the fat in order to stop any bleeding and have pure fat, and then you're doing pure sculpting and not being distracted by blood. The other thing that is a huge contribution to lipo, and I wish I had thought of it, but it wasn't me. It was a guy in the South who thought of it, something called equalization, which means you've done your lipo, everything feels good, looks good, but to make it even better, you're using a cannula, a tube, that has like a blown out, instead of the holes being smooth on the tube, they're kind of blown out. And without suction, you're passing that through. So it's disrupting fat cells and basically spreading things around, right? It's like doing internal fat grafting without ever removing the fat. So that's equalization. And that's an important step in making lipo just right. And the key is, again, doing it naturally, not overdoing it. So it's all those things together with a whole lot of experience that, leads to great results.